Hello viewers, myself Dr. Vindoo and I am Senior Homeopathic Physician at Nation Care Homeo Clinic, HSR, Bangalore. Nowadays we are also seeing the most common problem which can panic a female thinking it could be cancerous, that is the uterine fibroids. Due to this uterine fibroids, we have seen so many females undergoing the removal of uterus itself because of heavy bleeding, because of the severe pain that they would be going through. What are these fibroids? See, the main function of uterus is bearing child. So once you're into the reproductive age, obviously if your cycles are regular and there is no other hormonal issues, then everything is going smooth. But what happens is when you start with the hormonal issues, there's abnormality in the hormonal production. So suddenly you would say a growth, the accumulation of the muscles within the uterine lining, you can see a mass growing, which is of course most of the fibroids which are grown in the uterus are benign, that is non-cancerous. But when it is not timely treated in long run for years together, that might be a chance for the fibroid to convert to be cancerous. So finding out that you are having a healthy uterus is very important for a female post their 30s. So the changes that's happening, because the uterus goes through a lot of changes in a female's lifetime. From the time female attains menarche, every month it has to go through the changes. For example, the endometrial thickness grows thicker. Then on a monthly basis in the form of menses, the endometrial thickness is shed. So this all are controlled through hormones. Again, hormones are further, they are being stimulated through your brain. Obviously, having said that, when you go through a lot of trauma, mental stress, or the kind of lifestyle, so various changes, that could be pregnancy, that could be menopausal changes, again lot of hormonal changes also has influence on a healthy uterus. So when there is abnormality of these kinds of changes, suddenly there might be a mass that is growing within the uterus lining. So which could be submucosal fibroids. There are so many types of fibroids that a female can have. So pedunculated or subserosal, or you can have submucosal, or there could be submural. So all this based on the location of the fibroid, we can diagnose what kind of a fibroid is female going through. Especially post menopause, when female suddenly develops some kind of a bleeding, definitely a female has to go through transvaginal scan to figure out what exactly is the reason for the bleeding. Is there a fibroid, or it could be a cancerous growth also which is causing the bleeding, or excessive white discharge which happens through the vagina, that is post menopause. So post 30s, a female should extensively take care of her uterus and regularly screen her uterus if her uterus is healthy or not. So sometimes, people do get worried due to the excessive fibroid formation. When the endometrial lining is trying to shed during your menses, there is a severe pain, agonizing pain where a female can't bear it. So if you have certain kind of symptoms, definitely get a scan done, because there is a possibility that there might be a fibroid which is causing this severe pain. So the blood vessels, they don't stop. Menstrual flow does not stop timely because of these kinds of fibroids. So there is a heavy flow, there is a menorrhagia. This can lead to, the anemic conditions in a female. So we in homeopathy don't believe in just removing the fibroid. Again, there are so many things. The removal of the organ or removal of the tumor is not the permanent solution of any problem. We need to find out if there is any family history. Is there any cancer history, or is she going through any kind of diseases like thyroid, or is she taking any medicines? Some females, when they take this contraceptive pills or the usage of the hormones or any particular medicines, it could have been used for some other problem, but they would have triggered these kinds of fibroid formation. So homeopathy can beautifully help you to reduce or shrink the fibroid which is already there in your body. You need not worry about removing the fibroid, or need not worry about completely removing the uterus, which we call it as hysterectomy. Because there is an importance to an organ. Just by removing, you're just not removing an organ, you're trying to hamper a total system, which will cause a female suffering with secondary complications like putting on weight, arthritis issues, lot of mood swings, and a lot of other complications can also develop by removing uterus. So any female there, if you have any menstrual problem or you have any kind of abnormal symptoms that you see during your menses, or you already a known case of uterine fibroids, or any kind of symptoms you feel is going on with you, definitely you can reach out to us. We will definitely be able to help you out and get rid of the problem that you are going through.